Good afternoon, everyone. Looking forward to a great discussion today. Thank you so much for joining. Believe it or not, this is our November YVSC community meeting. Where has the year gone? Really delighted to have you here. I am Michelle Stewart, Executive Director of Yampa Valley Sustainability Council, and it is such a pleasure to be able to convene this conversation today, and I want to thank you all for joining. Many of you know, but YVSC was established as a nonprofit in 2009, and we are guided by the mission to serve as a leader, resource, and catalyst for building a sustainable and resilient Yampa Valley region. These topic-focused monthly community meetings are designed to convene leaders, program partners, and community members for presentations and discussions on key issues and initiatives so that we can learn together, ask questions, connect, and find ways to meaningfully contribute to the sustainable and resilient future that we need. For today's meeting, we have a great lineup of speakers who are joining us to begin a very important conversation here in the Yampa Valley, examining how and why climate change is an urgent health crisis. The World Health Organization states clearly that climate change presents a fundamental threat to health, and as you'll hear today, the consequences of the climate health nexus are already being felt, both locally and around the world today. The increasingly severe and frequent climate-related events around the world, from rising temperatures to floods, have significant direct and indirect impacts on human health. Recognizing the urgency and severity of the climate health nexus, the first ever Health Day was held actually last year at COP28, where 123 countries signed the Declaration on Climate and Health. Although it was a great step in the right direction, there is so much more work to do. Our healthcare ecosystem, which you'll hear about today, both contributes to and is impacted by climate change, which makes it a noteworthy institution in the work of mitigation and adaptation, and as well as data collection and increasing basic public understanding, basic science and public understanding about the complexity of the climate-health relationship. Today, we have the pleasure of having three medical professionals joining us to establish our conversation, sharing information about what research and clinical realities are telling us about the climate health nexus, how medical professionals are getting involved in policy and advocacy to drive system change, and some of the efforts being made at our local and statewide Yampa Valley Medical and UCHealth integrated system to mitigate contributions to climate change. Today's meeting will center around our speaker presentations, which will be recorded, and we should have time during the last 20 or 25 minutes for a roundtable Q&A. So please do think of questions that you can ask, and if you'd like to put them in the chat during the discussion, you're welcome. Otherwise, at the end, I can call upon people that unmute and make a sound, and I'll call upon you so you can ask your question too. Again, the purpose of this is to really build a community conversation, and so thank you for being here. And so at this time, it is my pleasure to introduce our speakers. First, we will hear from Dr. Katie Durrwachter-Erno. Dr. Erno is a neonatologist, MD, who has over 15 years of experience in hospital and healthcare industry. She is skilled in utilization management, case management, neonatal intensive care, and health information technology. She holds a Doctor of Medicine from Temple University School of Medicine, and she is passionate about the healthcare role in finding solutions to the climate crisis. She is a member of the American Academy of Pediatrics, and she serves as a climate advocate there. And since 2018, Katie has been working as the medical director for Progeny Health, which enabled her and her family to move to Steamboat. We're very lucky, 6 years ago from Pennsylvania. We will have two other speakers that I'll also introduce that will follow Dr. Erno. We have Amanda Kittleson, who has been the Clinical Quality and Process Improvement Manager at UCHealth for the past 5 years. She holds a Bachelor's of Science in Environmental Systems Engineering from Penn State and a Master's in Environmental Engineering and Water Resource Management from Villanova University. Amanda's professional background includes roles in environmental consulting and environmental health and safety, with expertise in manufacturing and oil and gas industries. And third, we'll hear from Peter Tozzi, who is the Sustainability Program Manager at UCHealth, where he focuses on ways to increase sustainability operations at UCHealth. Peter has worked in a variety of different sustainability-related roles in healthcare in Colorado and Illinois, And during the last few years, he has created and managed sustainability metrics dashboards for clinical and facility transparency to achieve department goals. He's organized and implemented sustainable training programs related to renewable energy, waste, and carbon footprint reduction. He's analyzed and implemented sustainable technical improvements to reduce Scope 1 emissions, and collaborated with supply chain and environmental health and safety operators to ensure that there is safer chemicals in medical supplies, furnishings, and janitorial products. So we have a stellar lineup of speakers. Such a pleasure to have this conversation today. And at this time, it's my great pleasure to turn the floor over to you, Dr. Erno.
Thanks so much, Michelle. So today I'd like to talk to you about how climate change is truly a public health emergency. Next slide. I would like to acknowledge that I am speaking today from ancestral lands of the Ute peoples, who historically called the areas of present-day Colorado and Utah their home, with historic hunting grounds extending into current-day Wyoming, Oklahoma, Arizona, and California. A land acknowledgement is a formal statement that recognizes and respects Indigenous peoples as traditional stewards of the land and the enduring relationship that exists between Indigenous peoples and their traditional territories. It's a practice that's becoming more common as people recognize the legacy of violence and displacement and move into a future of acknowledging truth and reconciliation. Next slide. To understand our present climate crisis, we first must look at our past. Prior to the 18th century, most cultures in the world were agrarian-based and produced goods by hand. The Industrial Revolution drastically changed the economy and culture. Fossil fuels, namely coal and petroleum, were extracted and used as energy sources for both fuel and power transportation. Coal and oil were used on a large scale by the mid-19th century, with coal being the predominant fuel source until the 50s, when it was overtaken by petroleum. When fossil fuels are used, they yield carbon dioxide. The graph on the right shows how CO2 emissions have increased exponentially following our increase in energy use. The chemistry of the atmosphere changed as a result of this vast amount of carbon that was released from the earth into the air and led to a rise in temperature, a shift in pH of the oceans, and a loss of biodiversity. Next slide. Most of us are familiar with the effects of climate change: melting of sea ice leading to accelerated sea level rise, longer, more intense heat waves, more frequent wildfires, longer periods of drought in some regions, an increase in the number, duration, and intensity of tropical storms, and severe flooding. Next slide. We may not realize how these planetary changes are relevant to health. The increase in CO2 in the atmosphere leads to changes in the middle of this graphic, including temperature rise, sea level rise, and weather extremes. These impacts lead to a variety of environmental changes in the middle ring, which ultimately leads to both direct and indirect health impacts. Changes in vector ecology lead to an increase in infectious diseases like malaria, Lyme disease, West Nile virus. Water issues like drought lead to agricultural losses and food insecurity. Air pollution and increased allergies lead to worsening asthma and other respiratory problems. All of these changes can impact mental health due to the stress of extreme weather and worsening health problems. This impact on mental health is sometimes referred to as eco-anxiety. And this anxiety can layer onto existing stressors and anxiety that people already face today, particularly our youth. In 2022, the Journal of Child and Adolescent Mental Health published a review article which included analyzing 33 articles on the impact of climate change on children's mental health. They found that children have a wide range of negative emotions, mainly anxiety, and they have called for the need for more research, which in medicine is the case in almost every area. Next slide, please. In Colorado, we're particularly concerned with air quality, especially during wildfire season. This photograph is of the Marshall Fire in 2021. One way to measure air quality is by measuring the fine particulate matter. Matter that has a diameter of less than 2.5 micrometers is referred to as PM 2.5 and is a component of both air pollution and wildfire smoke. Children with growing lungs are especially vulnerable to the impacts. The US EPA PM2.5 Air Quality Index is a number that measures 5 common air pollutants: PM2.5, ground level ozone, carbon monoxide, sulfur dioxide, and nitrogen dioxide. Purple Air is a website that uses their sensors to detect air quality and then communicate to the public how polluted the air is in different areas and can help make decisions on if it's safe to spend time in the outdoors. This screenshot from Purple Air is taken from this summer, July 2024, when smoky conditions were due to the Canadian wildfires. Next slide. I have a special interest in the impact of climate on the health of children. I co-authored this parent-facing article on the impacts of wildfire for the American Academy of Pediatrics for their website, healthychildren.org. Next slide. In addition, I have a special interest in the impact of climate on maternal child health. 2 OBGYN physicians wrote this systematic literature review published in JAMA in June of 2020. They looked at air pollution and heat exposure on birth outcomes. In their review, 58 of the 68 studies they included looked at air quality, and the remaining 10 looked at heat exposure. The authors explained that although there is not a cause and effect, it is clear that carbon emissions have an impact on both air pollution and increased heat. Next slide. One of the studies that the OBGYN physicians highlighted was this study from California, published in 2018 in the Journal of Epidemiology. The authors studied this natural experiment, which occurred when 6 oil-fueled electrically generated plants and 2 coal-powered plants were retired. Their data from 2001 to 2011 showed that preterm birth rates among women exposed to the highest amounts of pollution from the plants fell from 7% of births to 5.1% after the plant closed, a 27% reduction in the preterm birth rate. Women living within 5 kilometers of a plant showed that the biggest drop in preterm births after a plant closure. The improvement was the greatest among non-Hispanic, Asian, and Black women and did not differ between maternal education level. This type of study could never be done within a controlled research design, so the data they reviewed is very unique. In a commentary piece written by a senior researcher, showed that this natural experiment is often prone to other factors that could affect the findings, but in this particular case, the study team did a good job of trying to test alternative explanations. So again, not cause and effect, but a unique showing of a decreased preterm rate when these plants were closed. Next slide. This article, published in 2016, estimated the burden and costs of PM2.5 attributable preterm births. The cost estimated at $5 billion annually. An estimated 3% of preterm births nationally in 2010 could be attributed to PM2.5. Attributable preterm birth costs were estimated at $5 billion, of which $760 million were spent for medical care. Fossil fuel-related combustion exposure is a risk factor for preterm birth, as well as low birth weight and small for gestational birth. There are also risk factors for infant mortality. When we talk about risk factors for infant mortality and health disparities for minority and low-income populations, we need to be talking about clean air and environmental justice as well. Next slide, please. To delve deeper into heat as a factor for being detrimental to health, it's important to note this phenomenon known as the urban heat island effect. Human-made surfaces, streets, sidewalks, and buildings absorb more heat during the day and re-radiate it into the night, leading to heat that lingers and accumulates. This concentrated heat is often in areas with a high population density of vulnerable populations. The review by the OBGYNs had fewer numbers of studies looking at heat, but there were still large numbers of births to review, and they showed that increase in preterm birth, low birth weight infants, and increased numbers of stillbirths. And they mentioned that these were concentrated in urban areas, often the home to low-income and minority populations. In addition, this heat island effect will directly impact tourism to Steamboat as the Front Range experiences higher temperatures and people will come more often to mountain towns for respite. Next slide, please. There's a growing body of evidence that air pollution affects the developing brain. It harms learning, attention, behavior, and even sleep, which can come from both prenatal exposure and exposure during childhood. So when we think about school readiness, which is an important topic in pediatric public health, we need to ensure we're providing them with a healthy environment from the start. Next slide. Exposure to air pollution has lifelong health consequences. Exposure to fine particulate matter from coal combustion has a relatively higher effect on cardiovascular health than PM2.5 from other sources. This process works mainly through a pathway of inflammation, as shown in this graphic. PM2.5 air pollution is the most important environmental risk factor contributing to global cardiovascular mortality and disability. Short-term elevations in PM2.5 increase the relative risk of acute cardiovascular events by 1 to 3% within a few years. Longer-term exposure over several years increases this risk by a larger magnitude, about 10%, which is partially attributed to the development of cardiometabolic conditions like hypertension and diabetes. Next slide. There are ethical issues that are inherent to this topic that are important to recognize and discuss. One of the most salient ethical issues is equity. This graph shows the carbon footprint of Americans stratified by our incomes. There are higher levels of consumption in higher income households in every category: food, housing, clothing, transportation, and services. So the people who are putting carbon into the atmosphere are the wealthiest among us. There are vast disparities on who the biggest victims of the climate crisis are. People of color and low socioeconomic status are most likely to be negatively impacted by the effects of climate change. Next slide. On a global scale, the disparity is also apparent and getting worse. The wealthiest 5% of the global population accounts for over 1/3 of growth emissions since 1990, and the wealthiest 10% account for almost half. The poorest 50% barely increase their emissions at all, yet will be the most impacted. Next slide. On the positive side, we have shown that we can come together to take bold collective action in the name of public health. We are in a critical moment for action. We have about 10 years to take bold climate action to prevent runaway climate change. Thankfully, many professional organizations have recognized the urgency. There are many, but I will highlight a few. Next slide. In 2015, The Lancet created a commission which concluded that tackling climate change could be the greatest global health opportunity of the 21st century. And they highlighted a need for a global monitoring system with the ability to engage policymakers and support health professionals. Each year, the Lancet Countdown is published prior to the UN climate negotiations in order to provide data on how climate change affects health and on the consequences of delayed action. This collaboration of over 120 leading experts from academic institutions is made up of climate scientists, engineers, energy specialists, economists, political scientists, and public health professionals and doctors. Next slide. Professional organizations also are taking a stand. The American College of Obstetrics and Gynecology stated that they recognize climate change is an urgent women's health concern, as well as a major public health challenge. They say, we call on our national and international leaders to act to curb greenhouse gas emissions and limit further climate destabilization. Without question, climate change has a disproportionate effect on global women's health, as it broadens existing gender-based health disparities. The effects of climate change, such as food and water insecurity, civil conflicts, extreme weather events, spread of disease, and more, put women in affected regions at an elevated risk of disease, malnutrition, sexual violence, poor mental health, lack of reproductive control, negative obstetric outcomes, and death. This also has an impact on future generations, with the rate of low birth weight infants increasing in regions impacted by the effects of climate change, and with the erosion of the healthcare infrastructure needed to support healthy women and families. Next slide. My professional organization, the American Academy of Pediatrics, published a policy statement in 2015 which recognizes human causes of climate change, the effects it has on children's health, and actions healthcare providers can take. Next slide. In addition, numerous national nursing groups came together to make a stance supporting the urgency of climate action and created the Nursing Collaboration on Climate Change and Health. Next slide. There are a growing number of nonprofit groups that are dedicated to climate change as well, particularly the intersection of climate and health. Having clinicians speak to legislators about issues can shift the conversation and allow policymakers to receive information in a differently framed way. The industry and environmental voices can get caught in partisan battles, but we as trusted health workers who have dedicated our lives to the health of our communities can be heard across both sides. By using our health voices to amplify the message of climate action, we're creating part of the solution as a paradigm shift, as this is a public health and equity issue. Next slide. In addition, healthcare systems are also recognizing their role. The climate impact of the healthcare sector in the US is enormous. If the healthcare sector were a country, it would be the 5th largest emitter in the world. At the same time, an increasing number of hospitals and healthcare systems are making commitments to act on climate. Collectively, there is opportunity to make a very large impact. The Healthcare Without Harm Climate Council includes 19 health systems, which represent over 550 hospitals in 45 states with more than 1.2 million employees serving over 77 million patients each year. As these hospitals make commitments to transition to clean and renewable energy, they can have a dramatic impact on both policy and the marketplace. Now I'd like to turn over the floor to Peter Tozzi from UCHealth, as Michelle introduced.
Hey, thanks so much, Katie. Really appreciate the introduction and everything. So yeah, as Katie said, my name is Peter Tozzi. I work as the Sustainability Program Manager for UCHealth for the whole system, which includes 14 hospitals, which does include Yampa Valley Medical Center up there in Steamboat Springs. So I'm just going to give a little bit of an overview of some system-wide initiatives that we're doing, things that we've been doing in calendar year 24, some things that we're looking forward to in calendar year 25, a little bit of an overview as well of from like a scope perspective, what we're really looking at and what I'm looking at and what helps drive some of my different opportunities across the board. And then I'll turn it over as well to a couple of the individuals over the Yampa Valley team to go over and deep dive into a specific project that they really worked on at Yampa Valley Medical Center. And thanks again, Katie, for touching upon like healthcare without harm. You can see on the slide here, and I'll touch upon it in a moment here, but Practice Green Health is on this slide. Practice Green Health was formed to extend the work more or less from healthcare without harm to work directly with providers and healthcare systems to provide different resources and tools to help us implement different sustainable practices around. So really great work that helped out with from healthcare without harm. But really just what's on the slide here. So UCHealth as a whole, we're actively engaged in numerous different sustainable initiatives from all around the system from various different departments. And I can't do it just myself. It's driven by really strong commitments from a lot of different individuals from around the system, including those individual local that you have at your local hospital over at Yampa Valley. So a few of the bullet points right here, just highlighting some of these high level 2024 initiatives that we went on during this calendar year. Starting off with electric vehicle charging station expansion. We have thankfully some really great state and federal funding that's helped apply for some grants and some extra incentives to support a lot of these stations. We have so far 65 total electric vehicle stations installed across our system, which includes, like I mentioned before, 14 hospitals, and we have hundreds of outpatient clinics. So from across the board, we've got a lot of stations installed, but obviously a lot of opportunity, and there's a lot to do down the road, and a lot of other stations that we could really be installing to help promote additional transportation methods to get to and from work. Sterilized blue wrap recycling, kind of newer on the horizon for UCHealth and what we're looking at. Only a few of our hospitals has really been doing this initiative, and we're really looking in the next couple of years or in the next year or so to really expand this to our other hospitals, because sterilized blue wrap, just to give a little bit of an explanation, it's involved in every single procedure. When tools for surgery are prepared for surgery, they're sterilized and then they're wrapped in this blue wrap, which more or less is a really thin plastic material. A lot of the times, this wrap, just because it's so thin, is really tough to recycle and discard. And we found some providers within Colorado that have helped us recycle this material. And you can obviously assume from a health system as big as ours, we've got a lot. From hospital to hospital, there's a tremendous amount of blue wrap that we're going to be able to recycle. So looking to see, from what we already have in place, what other recycling opportunities can we look at and expand upon. We do a lot of collection and purchasing of reprocessed medical devices. What does that mean? Medical devices, we don't want to just use single-use devices. We want to use devices that we want to use reusables. We don't want things that are just always being single-use going directly into the landfill, as we can't use it in the system anymore. So we have a really great system of our practitioners that collect a lot of these different devices that then go to our vendors to be sterilized. We purchase them, bring them back into our system. Great way to divert landfill waste, as well as really just promote a sense of recycling and reusing reusables and sustainability and sustainable practices within our OR workspace. Reusable plates, bowls, and utensils. We have got a lot of cafeterias. We serve a lot of different staff, a lot of patients, and a lot of that is disposables. Anything that, a lot of things that go up to those patient rooms, they just want it simple, easy. A lot of those simple and easy things are disposables. But for a more sustainable future, we got to start looking at some of those things, that are a little bit tougher to do. And that's right along with reusables for our cafeterias, really trying to drive any patients that need it in the room. Reusables are the first, and then from special requests, then we can go to disposables where we need to. And the last bullet point I have on there is for composting. We use from that food points, there's a tremendous amount of food. We do a really great job across the board at knowing how much we need to purchase before it comes into our facility, so we reduce a lot of that food waste that we could see coming in. But and a lot of scenarios, we do have excess food waste. Where we do have that, some of our hospitals are donating that food waste to local providers, local shelters, and some of them are composting. A lot of really good methods we want to do to as well, reduce that waste that's going directly into the landfill. It obviously helps us too. Everybody's got to pay for waste. It helps us to save, we don't have to pay for all of that waste that's just being disposed of in the landfill when we can just repurpose it and bring it right back into the environment. So a lot of really good points, a lot of really good things that we're doing across the system, which does include locally at Yampa Valley Medical Center. The bullet I have below that, as I mentioned earlier in this slide, we have a lot of our hospitals partnered with Practice Green Health, and we do a lot of really, really good work with that network. We have 8 of our 14 hospitals currently enrolled and looking for this next calendar year for 2025 to have a few more, to have 12 out of our 14 and start to slowly trickle to get everybody enrolled in that. What is Practice Green Health and why do we really do it? The extent of this Partner for Change application that they put together every year puts together numerous different questions, sustainable questions from various different departments across the hospital. Anything from what energy you're using, food and nutrition. What food are you purchasing? Where are you purchasing from? Are you going towards a more plant-forward diet menu? And like transportation, like I mentioned before, what are you doing in terms of electric vehicle transportation? Are you encouraging folks to take the bus more to work or local transportation over just trying to drive their vehicle by themselves every day to work? It asks numerous different questions for every hospital that's enrolled. And we can really get a great sense of what are we specifically doing at our hospitals and what are we lacking? Where are those opportunities across the board? What are our other partner hospitals doing that we could be doing? So it's a good example. Yampa Valley is doing such great initiatives at their hospital here. When we do these applications every year, not everybody's checking off that same box as Yampa. So what could we do from best practices at Yampa Valley and bring them to the rest of the UCHealth system? Those are different things that we can look at from Practice Green Health. And we can also look at what are other hospitals around the nation doing? For a small hospital, for a big hospital, what are they doing? How are they approaching these different sustainable initiatives? And from my perspective and from any other healthcare system as well, that really helps us drive these different sustainability opportunities that we're looking to do. It helps us with the like bring all the information up the chain. If we ever have any questions or there's any pushback, we've got the answers, and we can really show this is what the best sustainable health systems are doing around the country, and this is why we're trying to do these different projects to try to get there. Next slide, please. Thank you. And this is just a really high level, not going to spend a whole lot of time on here, but just from a perspective of what, how much emissions is coming from a hospital, what am I specifically looking at? And our sustainability team, like looking at just like year over year. And from one of the previous slides that Katie also had, the Joint Commission, coming in, who's telling us, you guys are still, we're good to stay online as a hospital. From a sustainability standpoint, they're also looking at emissions, and they're trying to ask us year over year, what are we doing to better ourselves as a system? And right here on the screen is a breakdown of everything, all the different emissions that go into a hospital and really any company, and like what we're tracking. So briefly, I'll kind of go over here. Katie mentioned scope 1 a little bit earlier before. Scope 1 emissions, and you can see on the small sliver over here, is only 5% of this total pie. And that's everything we're directly burning, like on site. So our stationary combustion, if we have natural gas that we're burning directly on site, all of those waste anesthesia gases that we're doing for surgery, refrigerants like emergency generators, and as well as our mobile fleet. What are we personally, our company vehicles driving back and forth? Those are things that we can control. Those are direct greenhouse gas emissions under scope 1. Scope 2 emissions, still within our control, but things that we might not just directly see with our eyes on the day-to-day, which includes, electricity purchasing. We can see our lights go on and off every day, but I can't see I don't see, the lines bringing electricity from point A to point B. Steam that we're generating, heat and cooling. Also, again, things that we can control, but also not indirectly see. And that's that, you can see on the pie is there as well, 12%. So I've only got 17% added up. What's that other 83% of the pie? That's really what I'm looking at, what we're going to be looking at over the next few years with the Joint Commission. And a lot of folks, just like how the other healthcare systems around the nation are looking at, is scope 3 emissions. And that's everything else as a sector that we honestly can't control as much. It's a lot of what our vendors are doing, a lot of what our utilities are doing. I don't have the power to tell our utility how to run their company and how to do these different best practices. That's on them. We can definitely submit some letters and different jurisdictions and try to help with some of these difference, to help better some of these different utilities and emissions categories. But at the end of the day, scope 3 is really tough for us to really control. But as a company to measure, that's where we bring the opportunity. So across the board, you can see from besides scope 1 and scope 2, those two slices, everything else is scope 3, from what we're purchasing to what our employees from business travel, from like for airfare, from waste generated. I dispose my waste, but it's also sitting in the landfill. Medical waste gets disposed of. It also gets sterilized or incinerated. That takes energy to do both of those. How much energy does that take? So there's a tremendous amount that goes into the vision of and calculation of scope 3 emissions, but that's really what comes out of a hospital. It's all of these different categories. So from my perspective and how I drive some of my different opportunities around the board, generally it comes from scope 1 and 2. That's the things that we can directly measure and control. And those are the different projects that I can really grasp and work with my facilities or supply chain team to work with. But with scope 3, 83% of the emissions that we emit are from that. So the question, what can we do then as UCHealth? What can we do as Sustainability Council to, say, hey, these are different categories that are really emitting a lot of emissions. And, maybe company X isn't doing this best practice, but we should be. Maybe we could do a little bit of influence to maybe help them with that. So maybe that was a little bit more than what I was going to say on this slide, but just from a grasp and a perspective of it, there's a lot that's going into sustainability, not just from what UCHealth is measuring, but from healthcare across the nation and from companies around the nation. This is what they're looking at. They're looking at their scope emissions and seeing directly from each of these different slices of the pie, what can we influence and what projects can we do to influence it even better. So that's what I got on these slides. The next slide, I'm going to turn over to Dr. Katie Roman and the Yampa Valley Medical Center team. Dr. Roman, just as a quick note, I did add that little graphic you see in the top right that just breaks down those different anesthesia gases and the respective global warming potential. So you can really see how bad desflurane was compared to the others. But I will turn the floor over to Dr. Roman at this point. And if she is having any trouble, I can absolutely speak to this point. So, Dr. Roman, if you're on the call, if you're able to hear, feel free to jump in at any points.
I
Otherwise,
I
okay,
got
perfect.
it. Yep, I was stuck on mute, but I got
No
myself off there.
problem.
Thank you.
No problem. Perfect.
Well, yeah, thanks for that introduction. So this was one of the projects that we worked on at Yampa Valley Medical Center, but really at UC Health at every hospital, and it was the elimination of desflurane gas in the operating room. As an anesthesiologist, I just want to briefly explain that the list of gases that he put there are 4 different gases that we use to keep patients asleep during surgery. And as you can see, desflurane is by far and away the worst of the for global warming greenhouse gas emissions. And so we committed to decreasing and then eliminating the use of desflurane in our ORs here at Yampa Valley Medical Center. This has a direct impact on the environment. This is gas that after you've breathed it and exhaled is just sent off as anesthesia waste gases and can be pretty damaging. Um, Obviously, the anesthesia and analgesia are important for patient safety and quality care in the operating room, but we have other choices besides desflurane. And so even though it was a fabulous anesthetic that we all uh, felt was very helpful to the care of our patients, we have other tools in our toolbox. So we, in 2022, set out to reduce our usage of desflurane gases. We slowly, as you can see from the chart, tapered it down, and then by August of 2023, we completely eliminated it. As you can see, we do still keep our patients asleep here. You can see our use of sevoflurane, which is the least has the least global warming potential, has gone up. It's the blue line on the graph. We have approximately doubled our use of sevoflurane while we completely dropped our use of desflurane. However, overall, we're using less anesthesia gases altogether as well. We have made an effort to try to use less desflurane, or sorry, less sevoflurane as well, and fill that gap with some IV sedatives that we have that do not have the global warming potentials. So this was the project we worked on, and then we've Yampa Valley Medical Center isn't the only one in UC Health that has eliminated this. I can't speak to it being all of the hospitals in the system, but the majority of the hospitals in the system agreed to do this, and we have eliminated desflurane from our ORs.
Yeah, and just to follow up on that real quick, thank you, Dr. Roman. But yeah, and just
Yeah.
to follow up, we have officially eliminated desflurane for the whole UC Health system. So that was
Right.
official at the beginning of this year. I want to say April of 2024. So really, really great accomplishment by not just the Yampa team, but again, yeah, the whole system. So really, really tremendous work there. And that's what we've got. So happy to answer any questions from at the conclusion of this presentation, but I'll turn it back over to Katie.
Thanks so much. I just want to thank Dr. Roman and her anesthesia colleagues for being such change agents locally. And Peter, thank you so much for sharing all of the really inspiring work that UC Health is doing across the board and also in conjunction with Yampa Valley Medical Center. So these interventions in reducing carbon emissions and waste will lead to a reduction in carbon emissions, ultimately impacting the health of our community members with less heart disease, improved asthma symptoms, less cancer, better mental health, less infectious diseases, fewer preterm births, and improved child development. All of the interventions discussed today have impacts on health, which is why climate solutions are health solutions. And last slide. In addition to these initiatives, advocacy is also an important contribution health professionals can have on the climate crisis. We are trusted members of our community and have opportunities as powerful voices that can center and advance health equity. We know that health professionals are uniquely credible to all segments of the population when it comes to communication about climate change and health. We can help to depoliticize an issue that has unfortunately become very partisan. Advocacy is most effective when it's local, health-focused, and action-oriented. I'll share some examples of some of the work I've done. I'm a member of a group of pediatricians that across the country formed the Climate Advocates for the American Academy of Pediatrics. So I work with my local AAP chapter and a Front Range-based nonprofit called Healthy Air and Water Colorado to follow state legislation that's climate-focused and has health implications. With them, I previously testified to the State House of Representatives on a bill to increase community-level monitoring from refineries across the state and increase fines for violations, ultimately improving air quality. I wrote an opinion piece in the pilot during the last election encouraging voters to vote for climate-forward legislators. In addition to the wildfire piece I mentioned earlier, I co-authored a paper with a group of 4 other pediatricians regarding the intersection of the social determinants of health and the climate crisis, with examples from around the country. And I'm also on the board of Yampa Valley Sustainability Council, which has provided a meaningful connection to the people doing this important work here in Steamboat and the surrounding areas. Thank you so much, everyone, and we open the floor to questions.
Great. Thank you so much. Dr. Erno, thank you so much. Dr. Roman, thank you so much for joining us. I think Dr. Roman was joining us from the clinic, so she was unsure if she would be able to join us. So glad you could join. And Peter, thank you for that great overview. Such an important start to a really timely and important discussion. So at this time, if anyone has any questions, feel free to raise your hand and we can call upon you. And I know we had one that was being teed up by Dakota Dolan on our end. So Cody, if I can have you unmute and ask your question, and then others, please do. You can put a note in the chat. Feel free to raise your hand. Again, it's a friendly conversation. And Dr. Erno, Dr. Roman, and Peter, thank you so much for laying such a generative foundation for all of us to discuss and move forward from. So Cody.
Awesome. Thanks so much, Michelle. So on the topic of mental health, this week, YVSC interns learned about the Craig Sheckman Family Foundation Youth Wellbeing Initiative. So the purpose of this project is to build on research and existing community efforts that develop community-led plans for positive contributions for youth mental health issues. And their community advisory group, which was made up of 8 youth and 8 adults, were brought together to brainstorm 4 major themes that they identified, which were stigma, substances, parents and caregivers, and schools. And the group came together with many strategies, including school programs, teacher well-being, sober events, things like this. And they're looking for partners that can help move some of these ideas forward. And all of this being said, Mark Anderson and Aaron Axe from Craig Sheckman Family Foundation expressed that they noticed a large portion of youth distress is related to the climate crisis and environmental issues. So this led me to wonder, and I encourage you all to respond in this discussion, how can we as community leaders and trusted organizations address eco-anxiety among our youth and all community members? And where does the responsibility lie for addressing this challenge? And how can we, in our own circles, perpetuate hope for a better climate future? I can also connect anyone to the Craig Sheckman Family Foundation if they're interested in learning any more about these initiatives with youth mental health.
Yeah, this is Peter, Dakota. Thanks for all that. Yeah, if you don't mind connecting me after this call, because I don't have a tremendous answer from my ends, but I would absolutely be interested in connecting and learning a little bit more on that.
Yeah, absolutely. I can actually drop a link in the chat. I think they sent me a link in an email, so I'll definitely do that.
Great. And Dr. Erno, too, you had found that there was increasing, just efforts to try to understand the connections between, mental well-being and mental health and climate change. Not unlike, I think, what you've described as the public health impacts too, but curious if you've heard discussions among your colleagues or those that are involved in the advocacy work that you're participating in as well.
It's definitely a huge issue, particularly for teens and adolescents. It's hard to tease out social media impacts of how just social media in general has increased anxiety disorders, but it certainly has given these issues of climate more traction, and you can spiral down these rabbit holes much easier with social media. So I think that has really exacerbated just having so much information. And so there just really needs to be more research done. But I think having these conversations about social media aside from climate change, I think will be impactful to youth mental health as well.
Yeah, thank you. And this is a question both for Dr. Erno and Peter, and then we do have some that are coming into the chat. For those that see questions and you have responses, I see Dr. Erno responded to Susie's. If you have questions, feel free to respond to them in the chat, and then we can kind of highlight them verbally for those that are on their phone too. But in, you know, discussions and some of the research, and then now the coupling between research and advocacy, or, you know, kind of medical professionals taking a stance to be a trusted and authoritative voice, documenting the relationships between climate change, you know, and the urgent need to address that climate health nexus. Some of the kind of analyses have hinted at that it's very hard to understand clearly the complexity of the climate health relationship. You know, so we know that there's so many different kind of multipliers and components that impact any given, you know, public health manifestation of, you know, whether it's lung disease or respiratory illness. So those types of things, we see that layering happening, which can make it very hard to prioritize, you know, actions. And then also really trying to address and understand these nested and complex issues within the landscape of the medical industry and professionals that are trying to address public health, and then those that are trying to understand the climate science. And so I think that both of you represent a very important coming together, you know, of medical professionals that are, you know, actively addressing mitigation, you know, trying to understand how do we meaningfully adapt, and then importantly also engage with data collection efforts to really understand those changes. But in your own work and in your experiences, and since you're kind of representing this integrated approach to thinking about public and climate, you know, are you seeing a change in how people are framing the issues, or the way that they're talking about the usual kind of evidence-based approach to treating medical challenges, or, you know, medical industry period? I'd love to hear your perspectives on that. Like, do you see there being this integration in the field? What's your experience? So maybe Dr. Erno, and then Peter, if you'd like to add to that.
I do think just having an awareness and a conversation is really huge. So I think all of these professional organizations, I obviously can speak most about the American Academy of Pediatrics, but just having this group that came together with representatives from all 50 states, and then that really has a domino effect on the local level. So in Colorado, there are a small team of us as pediatricians who are scattered around the state, and we work hyper local, and then we work at state level. So that has just expanded when you find then another person who has an interest. So I think even in addition to research that's being done, as you mentioned, in an evidence-based way, I think just the boots on the ground impacts are really powerful as well. And so I think that each organization has that happening. Like I said, I mostly know about the American Academy of Obstetrics and Gynecology and Pediatrics, just having a maternal child health focus, but that is happening obviously in anesthesia with Dr. Roman's amazing work, and that really took a lot of coordination to do, not only across UCHealth, but that's being done nationally. And I just wanted to point out also that, as Dr. Roman touched upon, there were other anesthetics in their toolbox to be able to use, because ultimately patient care and safety is ultimately the most important thing. So if there is additional waste, it's for good reason. But if we do have alternatives, those are definitely being pursued. But I think it really takes groups of people coming together to make that hugely impactful change.
Yeah, thanks for that, Katie. Yeah, I was just going to say, yeah, I feel like from my area and from my network, I need to have like tremendous amount of like, obviously the support from like higher up goes a really long way, but bringing that together and having that like showing that not just we're doing like these projects and it's just not me running the show and like other people around the country are doing this is really really valuable. From year to year, I'll tie back a little bit to my slide with that practice green health. Um, Enrolled hospitals in that organization have like a forum that we're able to communicate back and forth sustainability ideas with each other, which really helps me bring a lot of those different ideas either to the table if I have no idea what I'm doing with an idea, or if I just want to like bring it out and just say, hey, what are other people doing? I I'll get a good response, even if it's not the best practice out there. It might be it's just something that somebody's doing, which is a good step in the right direction, which helps me and my team strive different opportunities. Practice Green Health each year puts on a conference, which I think really highlights how many different individuals are like involved with that. It's called Clean Med. It's pretty nice, but more or less with that, it's different sustainable leadership and representation from numerous different healthcare organizations and vendors around the country. And I think something like that it really helps me once I came back from that and I have all these different ideas and stuff. It puts it in perspective. Again, I'm not the only one, and we're not the only hospital that wants to do this. There's numerous amounts of people around the country that are doing this, and these are the reasons why they're driving these different projects. That that goes such a long way, especially with such a fresh program of sustainable. Like that's just how it is. Like nowadays, I'm not. This role is it's pretty new to UCHealth. I've been in this role a little bit over a year, and from a system wide role, that was the first for the company. Like there's a lot of companies doing a very similar like way right now, and I think just having that network and knowing that you have folks on this council that you can talk to and just run ideas by different. Everybody's got different contacts, but we've got a really good network, not just in Colorado, but around the whole country that we can work with to really drive some of these different goals.
That's great. Thank you both so much. Abby, you have a question if you would like to ask that.
Yeah, sure thing. Thank you guys all for excellent presentation. It was really insightful. I was just wondering on this slide about scope 3 emissions, Peter, there was one that said 28% of hospital scope 3 emissions are from investments. And so I was wondering, is UC Health taking steps toward addressing their investment emissions? And if so, what do those steps look like?
Yeah, it's a great question, Abby. I think a really long way that goes with it is like the state gives us a lot of goals. Like, so one example that I'll just directly use is like building systems or like building standards performance, which is statewide initiative from the state that we need to reduce all of our buildings that have square footage this big or this big by a certain amount by 2030, 2035, different years down the road, or else we're going to be penalized. And it's not good, obviously. So we know what targets we need to reach and how do we approach them? What's the best way to approach them? And from an investment standpoint, that's really like a lot of what are like our facilities, our design and construction team looked at this past year is from an investment standpoint and how much money we're going to be putting into like construction and then all these different buildings. What sustainable language, what different attributes can we add into these different projects to make this investment not just meeting that goal, not just meeting that different energy goal, but also meeting these different savings goals that we're looking at what, again, like what other hospitals are doing, what other healthcare systems are doing, what are they doing to just publish themselves outside of the norm. And I feel like a lot of people are really just trying to. It's tough in Colorado. It's tough because we got to meet these different goals, or we're gonna get penalized. But at the end of the day, too, we want to meet them in a sustainable fashion. So I think from a lot of what I've tried to integrate over the last year or so is that language, and what we're buying and what we're purchasing, what we're investing in as a company. Is it sustainable? Is it just getting us to point B, or are we able to make it a little bit more sustainable along the way? There's a lot of different investments that are out there, and I can definitely follow up with you too at a later date with just a little bit more elaboration on what we're specifically maybe investing in, and a couple other examples for you.
Thanks.
Yeah.
That's great. Again, thank you so much for the really insightful, informative conversation starter for us. This is the first, I think, climate public health discussion that's been hosted. And really, Dr. Erno, thank you for bringing this together. and for having the willing partnership with our UC Health partners there. Such a pleasure to have Dr. Roman join. I know we have Amanda Kittleson on as well from UC Health, and then Peter, just great overview. And then I'll just mention too, Peter, I think maybe you're finding, across the system, there's different opportunities for the UC Health hospitals and medical facilities to actually connect with regional climate action plans and initiatives that are underway kind of within the counties that they're housed within. I'll just mention, I know that members of the Routt County Climate Action Plan Collaborative are hoping to connect with UC Health and Yampa Valley Medical Center here to really try to understand what's happening in the local facilities, and then also just broaden the connection and opportunity to get more buy-in. You're demonstrating such a great commitment and the need for our institutional partners like you to really lead by example. And so even with the number of patients and clients that come into the different hospitals or clinics, talking about the initiatives that are underway, like the shift in, anesthesia gases to those that are less greenhouse gas, impact intensive, telling people that and the reason why is a really great place of connection. And then likewise, just being that lead by example partner for on the ground initiatives. So it's really exciting to hear about it. And Dr. Erno, thank you so much for the great overview of the literature and the research that really is clarifying that this is a really important connection. So I just want to thank you all. I don't see any other chats coming up in here that are tied to kind of thinking at the system level, climate change, public health discussions. I know there is an ask from the Routt County Climate Action Plan Collaborative Board to have a follow-up conversation. So that's an opportunity for UC Health and Yampa Valley Medical Center to really connect there. Thank you, Dr. Erno, for your advocacy and for your bringing together of your professional work and your experience and really your trusted voice and approach to, helping people, treating public health itself, like all of the different cases of neonatology, and really choosing to also engage at this time to be a voice and an advocate for, the medical industry to really take a stance and be an advocate for change as well. So it takes change agents like all of you to really do this important work, and it's just been such a pleasure to have this conversation. So I think that it is 2:00. We can end our conversation here. If anyone has any follow-up questions, please send us a note. This has been recorded, and I've had many people ask for a copy of the recording. And so sincere thank you to you, Dr. Erno, Peter, Amanda, and Dr. Roman, I think, has stepped off now, but I just want to thank everyone for joining.
Thank you so much. Thanks for the opportunity, Michelle.
Yes, thanks so much, Michelle. Thanks, everybody. Really appreciate it. Looking forward to any questions.
Great. Have a wonderful afternoon.